Okay, we know actually those who have some disease conditions or those who are hospitalized, they need to not only need the treatment, they need to do some non-pharmacological management also. Okay, and this nutritional assessment and nutritional management is the one of them, because our diet is directly and indirectly related to some of the disease conditions. For example, myocardial infarction. That means the main root cause for the myocardial infarction is atherosclerosis. How it occurs? Due to the the fat deposition in the blood vessels. Okay, that means that how it occurs, that is from the fat we are consuming during our food intake. So that only we are recommending the low fat diet, and those who are diabetic patient, we are recommending the low blood sugar diet like that. And for those who have renal diseases, we are recommending the renal diet. Okay, that means some electrolytes and some vitamins, some minerals, whatever it is, are getting from our diet, and when there is a deficiency or any excess in it, can lead to some of the disease conditions. So that the nutritional management is a part of our management for giving a comprehensive care to the patient. Okay, so the nutrition, usually it is refers to the intake and utilization of the nutrients. How nutrients are getting? We are getting the nutrients from our through our food. What are the food we are consuming? We are getting the vitamins, minerals, and essential that carbohydrate, proteins, even fat, everything we are consuming through our diet only. And how these nutrients are needed? The nutrients are mainly needed for our energy production, tissue repair, growth and development, and maintenance of the physiological function. That means we know that we are consuming carbohydrate, okay, and we are consuming protein rich diet. All these are undergoing for the metabolism, and it will produce energy for our tissue functioning, tissue multiplication, and even if any damage to tissue has occurred, the tissue need to be repaired, and the vitamins are needed for the tissue repair and for our bone development. Calcium is needed for our bone development, and most of the nutrients are mainly meant for our energy, metabolism, growth and development, and for the physiological functions also. That means we know that we have many systems. It is a network of systems contributing by our body: central nervous system, cardiovascular system, then reproductive system, musculoskeletal system. Actually, for a harmonious functioning of the each system, we need to take adequate intake of the nutrients. So nutrition has a vital role in our body for maintaining the harmonious functioning of our organs. Okay, so what are the components of a healthy diet? Actually, diet is the anything we can ingest through our mouth, okay, or we can drink. But there are healthy food items as well as unhealthy food items. Okay, so while consuming a diet, we need to focus on, is the diet is beneficial for our health, or is it cause any harmful effect our body? Like that, we need to know about the components of a healthy diet. Usually, I have already said that a diet should include carbohydrate, proteins, fat, vitamins and minerals, and adequate water is also needed for a cellular functioning and the metabolism. Okay. Usually the energy producing source, okay, is the carbohydrate. Carbohydrate is the one which is giving a highest amount of energy, that is about 9 kilocalorie is getting from a carbohydrate. Okay, and also protein is also needed. Protein is the source for a tissue repair and as well as for the maintenance of our immune function. Okay, that means the primary source for getting our energy is the carbohydrate one, but for the tissue repair and for maintaining the immune function, we need to take adequate intake of the protein. And fat are also needed, that because when we consume excess amount of the carbohydrate or proteins, the excess storage, okay, excess amount of that component is stored in our body in the adipose tissue. Okay, that means in the muscle and in even glucose is stored in the liver as a glycogen. Okay, like that, excess amount of this energy components is stored in the adipose tissue. As well as fat is also needed for our functioning of our production of our hormone also. That means our diet should contain all the components like carbohydrate, proteins and fats. These are the primary energy sources or primary components which need to include in our diet. In addition to that, we need to consume adequate amount of vitamins and minerals also, because our metabolism is mainly controlled by, for example, vitamin A, fat soluble vitamins and water soluble vitamins are there. Fat soluble means A, D, E, K. These are the fat soluble vitamins, and water soluble vitamins are vitamin B complex and vitamin C. I will see vitamins. What are the fat soluble? You need to know about it. Fat soluble are the A, D,
E,
E, K. Okay.
K.
So water soluble are, what are they? Vitamin B complex.
Minerals.
Yeah, not minerals. Vitamin and minerals are different part only. Vitamins are mainly two types, that are the fat soluble and water soluble. Okay, and mm, two types of this water soluble are the, what are they? Vitamin B complex and vitamin C. Okay, these are the vitamins which are essential for needed our body. Actually others also there, but essentially we are needed by this vitamins category A, D, E, K. That is because most of our cellular layer, okay, cell membranes are phospholipid bilayer. That means the nutrients needs to enter into the cells for the metabolism. Okay, and the vitamins, those who are fat soluble, it can easily enter into the cell. That is the fat soluble, and the fat is already essential for our functioning of our energy storage. That means the production of the fatty acid. Okay, as well as it is needed for the production of some hormones also. That means most of the hormones or most of the cells are made by the cellular membranes, the phospholipid bilayer. So the fat is essential. Phospholipid means fat. Other name of the fat is the lipid. So the fat is also needed for our what essential as a hormone production as well as the storage of the energy. And also adequate intake of water is also needed. We know that not only through our body is functioning. That means, for example, we are consuming water, we are eating food. Okay, everything is, we are getting adequate hydration through the water. Okay, as well as we are getting the adequate nutrients through the diet. That means in addition to the diet, you need to take adequate intake of water also. So that means for every metabolism, actually for this tissue repair or the even the glycolysis or any of the metabolism, the water is getting released, because water is needed for the all of the metabolism. So adequate intake of water consumption is needed. What happen if you are not consuming adequate water? It can lead to starving of the cell with the water. It can lead to dehydration. So it can hypovolemia, dehydration, even it can lead to what, shock, because of the low cardiac output, because our body is 60% is it's filled with the water only, because we need to take adequate intake of water for the normal functioning of our body and normal functioning of our cells and the normal functioning of the hormones. Every metabolism, adequate intake of water is needed. See, if we are imaging one plant, we are giving some no, not only we are giving that what happened, what are the items which is growing of the plant. We are daily we are adding the plant water also. If we are not pouring the water for 1 or 2 days, what will happen? It will easily dry out. Okay, because the photosynthesis can't happen, because the water is needed for the photosynthesis in the plants. Likewise, in our body also, the energy is producing or the cells are doing this multiplication or metabolism. We need water also. This is the basic component we should include in a healthy diet. Understood? What are the
Yes, ma'am.
components of a healthy diet? Carbohydrate, protein, fats,
Protein,
vitamins and
fat.
minerals, and water are essentially needed for our cellular function and transport of the nutrients. Okay. So, what are the clinical consideration? That means how the nutrition is related in the clinical relevance. That means, for example, we know that in the hypertension, the main cause of the hypertension is the high. What if we are taking highest amount of salt? Okay, it can lead to what? It can lead to hypertension. So that only for a controlling of the hypertension, we are recommending the sodium restricted diet or salt restricted diet, because we know that from the renal tubule sodium and water is getting reabsorbed. Okay, so in case of hypertension we need to restrict the sodium containing diet in order to maintain the blood pressure. That means how it is occur, that is related to the renin angiotensin aldosterone mechanism. That means whenever there is a hypovolemia or when there is a low BP, the liver will produce angiotensinogen, kidney will produce renin. Okay, this renin will convert this angiotensinogen to angiotensin 1. Okay, and from the lungs the ACE is producing. That means angiotensin converting enzyme is producing. This enzyme will convert the angiotensin 1 to angiotensin 2. Okay, this angiotensin has a direct effect on the blood vessel and it can cause vasoconstriction that will increase the BP, and also angiotensinogen will act on the adrenal gland to produce the aldosterone, and this aldosterone will act on the kidney to reabsorb the sodium and water. That means it can also lead to the increasing of the BP. It can also lead to, that means hypertension as well as the sodium uptake is getting reuptake is happening by the aldosterone. How is that is the way the hypovolemia and the BP is managed through the, it is only the one mechanism, it is not the main. That means there are so many mechanisms are there. Even baroreceptors are activated in case of low BP. Then it can also cause it can lead to increase in BP high. That means for a normal maintenance of the BP and even heart rate or even our respiration, even our hormonal functioning, okay, our body functions are mainly done through the cellular metabolism and functioning of the hormones in a harmonious way. If there is any errors in the functioning or in any excess or deficient intake of the nutrient can lead to contribute to some disease conditions. Okay, so for example in just for your knowledge I am saying, in case of hypertension we need to recommending the salt restricted diet or limit the sodium to prevent the hypertension. And those who have the diabetes mellitus, we are giving health education to reduce the sugar intake, because when we are consuming the sugar it can cause the production of the blood glucose. Okay, it will increases the blood glucose and it can worsen the condition diabetes mellitus. And in case of cardiovascular disease, we are mainly instructing to consume low fat diet or avoid saturated fat. That means we know that the fat can be low density lipoprotein and high density lipoprotein, and high density lipoprotein is a good cholesterol, but low density lipoprotein is the bad cholesterol in our body. Because so we need to avoid saturated fat or the low density lipoprotein in our diet, like oily food, fried items and meats. Okay, all these things we need to limit when we that is the focus to prevent the cardiovascular disease, because when we consume excess amount of the fat it can lead to atherosclerosis and hardening of the blood vessel. It can lead to thrombus formation, and finally it can lead to myocardial infarction, cardiac arrest and death of the patient. Okay, that means even the diet is contributing our life expectancy. Okay, and also in some kind of special populations like pregnancy, adolescence, and here our cellular metabolism or functioning of our cells are different as from a normal person. For example, in case of pregnancy, we are carrying the fetus, though the fetus is getting the diet and nutrients from through the diet which is consumed by the mother. That means whatever the diet which is consumed by the pregnant mother, and through the placenta, okay, this nutrients is transferred for the fetus. That is, fetus getting all the nutrients, water, mineral and everything from the maternal diet only. So here the pregnancy need an extra nutritional preferences. In case of adolescence, we know that the adolescence is the transition period from a childhood to what an elderly one. Okay, so here also the functioning of our hormone, main hormonal changes are happening during the adolescent period. So here also we need to take care in our diet, and in elderly persons also. Here also because of our the cellular functioning will get delayed because of our advancing age. So here also the client need an extra nutritional supplementation. For example, calcium. Those the women who are undergoing for the menopause, they need to consume additional intake of the calcium supplement for our bone health. Otherwise, what happen? Our body in after those who are having the menopause or after the 30, the bone health is getting weaker. It can lead to osteoporosis. Okay, so to prevent, as a preventive measure to osteoporosis, we need to take an extra intake of the calcium, vitamin D, like that. Okay, that means through the even the special consideration for the nutritional intake is recommending for the pregnancy, adolescents, elderly persons, and those who are even those who are having some disease condition, they need to take a special consideration in their diet. Okay, so you got a basic idea about what the nutrition is contributing in our health or diseases, Ashwini? Because
Yes, ma'am.
if you have got an idea about the basic thing, I can go little bit fast, because this basic thing you need to undergo what is the important role of our nutritional role in our health as well as in our disease. Okay,
Sure.
is it boring?
Mm.
Okay, I know it's a little bit because it's entirely different from a disease condition, so it would be some boring topic, but we need to. And the next one, the nutrition assessment. For example, for the children or for the elderly person or those who are overweight, underweight, we need to calculate our body mass index. Okay, body mass means our weight of the body. That means our weight in kg divided by height in meter square. That means we should have the weight. We should maintain the weight according to our height. If the weight is exceeding the height, that can lead to what? Overweight, underweight, like that it can lead to. That means it can contributing some disease conditions like cardiovascular disease, or obesity can contribute to many disease conditions. Okay, so our body fat as well as our nutritional status is calculated by body mass index. That's the time, the BMI. Okay, that is body mass index. How it is calculating? This is a tool. Okay, this is screening tool with the clinical context. That means according to the value of the BMI, we can say whether the client is underweight, having no adequate nutritional status, or overweight, obesity, like that we can categorize it. The formula is weight in kg divided by height in meter square. So this is the body mass. See, if 18 to 28 can be considerable as a normal. Okay, even 18 to 26 can be considered as a normal. But here, if it is a less than 18.5, that means when we are calculating, okay, weight divided by height in meter square, okay, that is the BMI index. So body mass index. So if we are getting the value, if it is less than 18.5, we are considering it as an underweight, and if the value is considering as 18.5 to 25 as the normal one. Okay, and when the value is 25 to 30, we are considering it as a overweight. That is not an obesity. That means above from the normal range. That is the overweight. And if it is, we are getting the BMI value greater than 30, the client is having the obesity is a condition that is contributing to many disease conditions. Here we need to restrict some of the diet. The client needs some exercises. Okay, he need to do walking, running, and also he need to control the diet like that. Otherwise, he can go into many disease conditions. Okay, so this is the value mainly underweight, normal, overweight, and obesity. These are the the conditions which are correlating with the using the formula body mass index. Understood, Ashwini? Can you please repeat the
Yes.
same? Can you please repeat it? What is body mass index and what is the value which are contributing underweight, normal, overweight?
Body mass index is assessment of the body fat and nutritional, a tool,
Yeah,
using a tool,
yeah.
like weight in kgs and then divided by height in meters.
Meter square. Meters.
Yeah.
Yeah.
If it is less than 18.5 is underweight. If 18.5 to 25 is normal,
Yeah.
and 25 to 30 is
Overweight.
I mean overweight,
Yeah.
above 30 is
Obesity.
obesity.
Yeah, that means in obesity, even when we are getting a overweight, also he needs some diet control. But when the person is dealing with the obesity, he needs some extra consideration. Like means he need exercises, he need diet control like that. Okay, extra care is needed in case of obesity because obesity can contribute many disease conditions. Okay. So, what are the lab indicators of a nutritional status? First one, serum albumin. We know that the albumin, the liver is the main organ which are detoxification is occur, and as well as the nutritional metabolism occurs, and the storage of the nutrients occurs mainly in the liver. That means the liver is producing what some albumin is a protein component. Okay, albumin, for the production of the albumin, we need to take adequate intake of water. The albumin is maintaining our many of the body functions. Okay, so that only then when there is deficiency of the albumin, it can lead to edema. Okay, so we need to take adequate intake of protein diet. So the lab value which contributing our nutritional assessment is the first one, albumin, serum albumin level. The normal value is 3.5 to 3.4 to 5.4. Actually, what is the function of serum albumin means it maintains the oncotic pressure and transport the substances. We know that in our body the nutrients are traveling through the osmosis. The main transport system are the diffusion, osmosis, and ultrafiltration. Okay, that means in the osmosis the water is moving through the in and out of the cells. For that we need oncotic pressure. This oncotic pressure is, that means the pressure which is needed for the osmosis, that is the oncotic pressure. Okay, so for the maintenance of the oncotic pressure we need to take adequate albumin in our diet, means our body. Okay, how we are getting the albumin? Through the diet. That means mainly from the protein rich diet
Yes.
we are getting the albumin. So albumin is essential for our maintenance of the oncotic pressure as well as the,
Transport.
because this
Transport.
oncotic pressure determines the transport of the substances. That means even if we are consuming the nutrient, if we are lacking the protein in our diet, what happen, we are the albumin content in our body won't produce it normally, so it will affect the transport of the substances. So that only we are saying in our diet we should include only carbohydrate is not recommending, only protein is not recommending, only fat is not recommending. We need to mix the energy products, like means we need to, in our diet we need to take adequate carbohydrate, protein, fat. Okay, that means if we are taking in a sufficient way we will get the adequate nutrients. Okay, so that our body cellular metabolism, tissue repair, transport of the substance can be occur in a normal way. When there is a low albumin level, it can lead to water malnutrition. That means low albumin level is notified in case of malnutrition. That means malnutrition means if you are not taking adequate energy intake, and liver diseases. In liver diseases what happen, the albumin is synthesized in the liver. When the our liver having any inflammatory condition or liver diseases, it will affect the production of the albumin. So that only in case of liver cirrhosis we are administering extra albumin
Yeah.
supplement. Yeah, that means the albumin is not produced in our liver in case of liver cirrhosis. Okay. And also in case of inflammation, that means that even in acute response we need to when we check our blood albumin level we will get a low value. Okay. And when we get a high albumin level in case of dehydration and in burns and surgery we will get a high albumin level. Okay. That means the albumin is mainly needed for maintenance of the oncotic pressure as well as for the transport of the substance from the in and out of the cells. Then there is in case of malnutrition, liver diseases or any liver inflammatory conditions, we will get a low albumin level. And in case of dehydration, dehydration means I have already said, that means here the oncotic pressure is low because of the we are not getting adequate intake of water. Okay, so that the function of the albumin will not taken place normally, so our blood will show a high albumin value. Okay. And also in case of severe stress, here also burns and surgery there is a loss of water. Even during the surgery there is a extra loss of the blood occurs. And in case of the burns also there is a dehydration, hypovolemia can occur. It can lead to high albumin level. Okay, so here we need to restrict water the albumin level need to be controlled in case of dehydration, surgery and burns. But in case of liver disease and malnutrition we need to supplement extra albumin. Okay. So, and pre-albumin means the normal level. That actually this much details you not needed, but just you need to understand what are the things which are related to disease conditions. And also, if it is less than 60 milligram per deciliter, it indicates the early malnutrition. Okay, pre-albumin is more sensitive indicator of a short-term nutritional status than albumin. That means when we check the albumin level in the blood, we can look for the pre-albumin as well as the albumin level. But most indicative tool for the albumin level in our body is the pre-albumin. That is the if our body is lacking with the albumin, or if it is the albumin is excess in our body, when we check the pre-albumin it will give a sensitive. That means automatically we will get the deranged value. Okay, about our nutritional status. So this is the importance of albumin in our body. Next one is the therapeutic diet. Therapeutic diet means what? The control of the diet which are maintaining when we experiencing any disease conditions. Okay, that is the therapeutic diet, because the dietary management is needed for the maintenance of the nutrition for the management of the many of the disease conditions. And for your knowledge I will tell you. See, in case of burns, okay, I will tell you the detailed one. In case of burns, we need to take because we need tissue repair. Okay, burns, in case burns, what happen? Our epithelial tissue, dermis, sometimes in case of severe burns, even the burn can destroy our dermis also, because our bone covering or tissues are getting destroyed in case of burns. So in such cases we need to supplement extra protein, because protein is needed for our tissue repair and calories needed for our energy metabolism. Okay. So in case of burns, we need to recommend what? High protein and high calorie diet. In case of celiac diseases, we are recommending gluten-free diet. Okay, the mnemonic is bro. Bro means B means barley, R means rye, O means oats, W means wheat. This diet is this is very important. Celiac disease diet. Gluten free diet is recommending in case of that means gluten free diet is recommending in case of celiac disease. The mnemonic for the gluten free diet is the which one? We should not consume barley. We should not consume rye, oats and wheat. Mainly we will get the options in the questions. Okay, so you have to memorize it as a bro. B means barley, R rye, O oats, W means wheat. This is the gluten free diet means no bro. These are contain barley, rye, oats and wheats contain highest amount of the gluten, so it need to be limited. And in case of constipation, we need to take adequate intake of fluid. Why? Because to soften the stool, we need to take adequate intake of the water, and we need to consume adequate fruits and fiber rich diet. This is very important as a management of the constipation. High fluid intake, high fruit intake, and high fiber intake is recommended. Okay. And in case of COPD, here also we know that in COPD, because of this the patient is using the vocal breathing is getting higher. Vocal breathing is higher because the metabolism of the cells are higher in case of COPD. So here the client need additional caloric support. Okay, additional fat and the small and frequent feeding. Why? Because in COPD the client is not able to breathe out completely. So if we are if the client is consuming a heavy meal, the work of breathing can get increased. How the work of breathing is increased? When the stomach is full, what happen? The diaphragm will goes into the thoracic cavity and will limit the even the client is struggling with the breathing because of the retention of the carbon dioxide. Because in COPD there is a hypercapnia. That means the carbon dioxide is not exhaling out completely. So when the client consume highest amount of food, what happen? It will limit the space of the thoracic cavity. Already there is widened barrel chest is already there, and if your diaphragm is pushing up, it will limit the space of the thoracic cavity, so it can worsen the respiration. That means the work of breathing can get worsened. So here we need to recommending the small and frequent feeding for in case of COPD. Okay, that means high calorie, high fat, and small and frequent feeding are recommended in case of COPD. And in case of diabetes mellitus, we need to reduce the blood sugar. Okay, so we need to restrict the fat intake as well as we need to reduce the carbohydrate intake, because this carbohydrate can directly convert to glucose, so the blood sugar increases rapidly. So to also control the blood glucose level, we are limiting the carbohydrate intake. Also, we can recommend the fiber intake to relieve from the constipation. And also in case of diarrhea or vomiting, we need to through the diarrhea, that means through the stools and through the vomitus, we are losing an excess amount of the water. Okay, so we need to replace it. Not only water, we are losing some electrolytes also, so we need to replace it. So adequate intake of fluid and the electrolyte replacement is needed. And also we need to recommend low fiber diet in case of diarrhea. That means if we are in case of diarrhea, if the person is consuming low fiber diet, it can cause further diarrhea because it will loosen the stools. Okay, so we are recommending low fiber diet in case of diarrhea and high fiber diet in case of constipation. Understood? That's very important, because in constipation, in order to loosen the stools, we are recommending high fiber diet, and in case of diarrhea, we are recommending low fiber diet. And if the client is having any gallbladder disease, we are recommending high protein and low fat diet. Because here in gallbladder disease, what happened, there is bile is not eliminating through our body, so the bile is getting accumulated. So here we need to decrease the fat intake. Okay, that means if you are increasing the fat supplement, again there is lead to the accumulation of the bile. It can lead to jaundice. Okay, it can worsen the condition. So we need to restrict the fat intake, but we need to increase the protein supplements. And in case of heart failure, we are restricting the sodium as well as the fluid, because it can lead to the edema. So we need to limit the intake of the fluid. That means we are recommending restricted amount of the fluid in case of heart failure. Okay, but otherwise it can, because already in heart failure the heart is not able to pump adequate blood out from the heart. So what happened, this blood will regurgitate. It can first cause the left heart side failure, then it can cause the right heart failure, side heart failure. That means there is, because of the regurgitation of the blood, when the client is experiencing right heart failure, the client will show the systemic symptoms like jugular venous distension, edema, ascites can be happen. So here we need to restrict the fluid as well as we need to restrict the sodium also. Okay. And in case of hyperlipidemia, what happened? Hyperlipidemia means there is already the fat is high or the cholesterol is high in case of hyperlipidemia. So we need to reduce the fat intake as well as we need to reduce the caloric intake also. And in case of hypertension, we are recommending a DASH diet. DASH means 3 S. You can remember memorize it. S means decreased sodium. Yes, next decreased saturated fat and decreased sugar. Okay, these are including in the DASH diet. What are they? Uh, in case
Decrease
of
sodium.
hypertension, yeah, decreased sodium, decreased saturated fat. That means low density lipoprotein is what are the diet which are contributing the low density lipoprotein. We need to reduce it, and as well as we need to decrease the blood sugar also, because when the client is having hypertension, automatically it can leads to diabetes also, because these are what related each other. That means those, see, if we are collecting a history from a patient, those who are having a hypertension, it automatically he is prone to get diabetes also. Those who have diabetes, because in case of diabetes also there is a glucose is high, it can lead to the hardening of the blood vessel as well as it can lead to the vasoconstriction. So hypertension can occur. And in case of hypertension also vasoconstriction is there, so it can lead to affect the blood flow, so it can lead to the contributing to the diabetes mellitus also, because mostly related each other. And in case of kidney disease means renal disease, we need to restrict the protein and we need to increase the calorie and fluid also. Here we need to restrict the fluid intake. That means in we know that the blood is filtering in the kidney. Okay, so in case of kidney disease or any stage of the renal failure, what happened? The kidney tubules are not function properly. That means the blood is not completely filtered into the urine. So what happened? It can lead to decreased urine output. So here the if the kidney is not functioning, even if you are giving intake consuming a large amount of water, what happen? It can increase the blood volume. The blood volume is not getting it filtered, so it can lead to all the water waste can be accumulated in the blood. It can cause some other disease conditions. Okay, so we are limiting the fluid intake because the kidney is not functioning. That means because of the rate of the kidney filtration is the glomerular filtration rate. So if there is a decreased glomerular filtration rate, means the kidney is not filtering blood into urine in a not adequate amount. Okay, that means the 125 ml per one per hour is the normal filtration rate for a that means the normal GFR. Okay, so if the our kidney is not a filtering our blood into urine, it can affect the urine output. That means it can lead to decrease the urine output. Okay, and in case of pancreatitis, we know that in the pancreas, mainly the cells of the pancreas, alpha cells and beta cells are controlling our blood glucose level. That means the alpha cells produces the glucagon, it will increases the blood glucose level, and the beta cells produces the insulin, it will decreases the blood cell. Okay, that means insulin decrease blood glucose. So that only in case of diabetes mellitus, as a management, we are administering insulin to lower the blood glucose level. And next one is glucagon. Glucagon will increase the blood glucose
Increase
level.
the blood glucose level.
Increases the blood sugar. Okay, understood the difference. And one more thing, this glucagon is produced by the alpha cells. Okay.
Mm.
Glucagon is produced by the alpha cells, and insulin is produced by the which cells, actually? Beta cells.
Beta cells.
Yeah, that is basic thing. Okay,
Mm.
That means the beta cells of the pancreas, islets of the Langerhans produce the insulin. It will lower the blood glucose level, and the glucagon which is produced by the alpha cells, which will increases the blood sugar level. Okay. So in case of pancreatitis, what happen? It can affect the control of the blood glucose. Okay, because glucose is the primary one which is needed for as a primary energy source. Okay. So here, in case of pancreatitis, here we need to recommending a small and frequent feeding as well as decrease the fat diet, because when the client consuming highest fat, this fat metabolism is not happen completely. It can increases the indirectly cause the blood increases of the blood glucose level. Okay. And in case of stroke, we can give mechanical soft diet with regular diet. Sometimes the client is not able to chew because of the stroke symptom. That means if stroke means what, any of the cerebral arteries occluding with the thrombus, so it can affect the blood supply to the neuronal tissue. It can cause the necrosis of the nervous tissue. Okay, that means the nervous tissue is not functioning normally. So here it can affect the all the neuronal functions. That means the by assessing the Glasgow Coma Scale, that means our memory, our motor response, our verbal response, and affect the all the nervous function. That means the central nervous system functions affecting. So in case of stroke, that means affect our chewing is also, because in our body we know that cranial nerves and the spinal nerves are controlling all of our body functions. Okay, that means chewing also, when there is a stroke, it can affect the functioning of the nerves also, nerve functioning also getting affected. So if the nerve is not functioning, for example in case of stroke, the client is not able to chew properly, swallow properly, because the glossopharyngeal nerve is getting affected. Okay, that means here we need to, sometimes the client supplement through the tube feeding, sometimes we can give the clear liquid or soft diet according to the capacity of the patient, or according to the swallowing capacity or the chewing capacity of the patient, we can recommend the diet. Okay, these are very question asking areas, and you need to make a chart or anything, and you just look through it. Gluten free diet, and here the small and frequent feeding in case of COPD, high caloric diet, like that. And in heart failure, we need to restrict the sodium and water. Hypertension, dash diet. Okay, and in case of stroke diet, stroke is that other important one. And one more thing, this gout. Okay, in case of gout, we need to limit the urine intake. Okay, that also it's important. That is coming in the coming topic. But we need to know in what are the conditions, in what are the restriction of the diet we need to focus. That is coming under the therapeutic diet. Okay. So in the mainly types of the therapeutic diet are the regular diet, liquid diet, soft diet, diabetic diet, calorie control diet, and low cholesterol diet. Okay, and the clear, and can I go a little fast? I think you got a
Yes, yes,
okay,
yes, ma'am.
okay. Because is it clear? No, if it is clear, I can go fast. Otherwise, you will get confusion. It is clear about this therapeutic diet. This
Yes,
the diet which is restricting with each conditions. Is it okay? No.
yes,
Yeah.
yes, ma'am.
Okay. Okay. Clear liquid diet means when from the term itself we can see the clear liquid diet.
Clear.
Clear liquid diet means mainly the liquids is the main component in that diet. Okay. Here mainly it is recommending for a minimal residue in the renal tract. We are recommending a clear liquid diet. Example: water. Water, gelatin, clear juices, tea, coffee. These are the liquid diet. That means only there is no other sediments or no other food items are there. Only the liquid components are there. Okay. Mainly this liquid diet are recommending as a preparation of a bowel preparation. That means if the client is undergoing for any surgery, we need to we will provide enema, as well as we will give health education that to consume a light meal before the surgery. Is it why? Because otherwise, if the client consuming a heavy meal, it can form a bulky stool, so it will affect the, because we know that after the surgery it will affect the client's bowel movement. Okay, so it can further cause constipation after the surgery. So in order to clear out the bowel prior to the surgery, as a tool for the bowel preparation, we can recommending for a clear liquid diet. See, where are you working, Ashwini? ICU. If you
Yes.
have you worked in any surgery department as a,
Yes,
that
I
means,
know we will visit the patients. Yes, ma'am. Yeah.
then you know about how, what are the pre-operative we have a checklist on the pre-operative preparations, is it? And on the
Yes.
previous day, morning, evening, night, three different preparations are there for the surgery. That means, for example, if tomorrow is the surgery, on the previous day, during the morning shift, we will complete all the consent, and we will that means patient will admit to the hospital, and he will do all the blood test, and we will take the printout of the report and all. Then only we are posting for the surgery. Okay, and if the client has posted for the surgery, next step is what we are preparing the client about this, about the some medication need to hold it, we need to hold the medications, and we will instruct the client to avoid heavy meal. On the previous day of the surgery, we will recommending only a light meal. That means in our hospital, those who are undergoing for any cardiac surgery, I have seen that during the night shift we are up to 12 o'clock. Even the patient is posted for the surgery, we will instruct the client to avoid a heavy meal. Okay, so that we will give you a light meal on the previous day, and after 12 o'clock. Okay,
Yes,
after 12
we
o'clock we will
provide.
keep on the NBO for the patient. But if the surgery is planned for in a late afternoon, we will give the early breakfast. That means at the 4 o'clock we will provide breakfast, that also light meal. Okay, and after that we will keep the patient on the NBO. But we will provide some of the surgery, if the surgery is related to any lower abdomen surgery, for example in case of LSES also, or any abdominal surgery, we will recommend the bowel preparation, or we will provide the enema also. Okay, after giving the enema, we will tell the client not to consume a heavy meal, only you can consume any liquid diet or any soft or light meal can be recommended. Okay, so that means it is the management is needed for the surgery as a pre-operative preparation. And also in case of post-operative surgery, we know that after the surgery, during the surgery we will paralyze our body. That means by giving the muscle the relaxant, and we will paralyze our body, so that even after the surgery, the effect of the medicine, of the sedation, muscle paralyzer, that won't come into normal. That means it takes some time to bring our body functions into normal basis. So in that period, the initial period, the constipation can be constipation means the bowel movement can be diminished during the first stage. So in such cases also we are not recommending in the the heavy meal. And also after the surgery we are sometimes intubating the patient. So the after checking the gag reflex only, we are starting the feeding. Okay, if the client has the gag reflex has not returned back, we should not start the oral feed. Why? Because it can cause aspiration. Okay, so that means um, on the previous day of the surgery as a preoperative preparation, and even after the surgery as a initial management for the immediate post-op period, we are recommending what diet? Clear liquid diet only we are recommending. And actually here it is not adequate nutrition is not included in the clear diet. Okay, it is recommending for a short term usually. That is, I have already mentioned that the either for a preoperative preparation or for the initial immediate postoperative management. Okay, initial stage of the postoperative recovery. So in such period we are recommending which diet? Clear liquid diet. And next one is full liquid diet. Full liquid means only clear uh, liquid, but we can add up with the dairy products, and some even fruits can be what pureed means like the smashed
Yeah.
what
Boiled
shake
and
like shake control. Okay, so example, milk, soup, juices, pureed vegetables. For infants and all, we are providing pureed vegetables. That means
yeah.
the vegetable itself, the infant cannot chew and swallow. So what we are doing, even the rice and vegetables, we will make into pureed form, and we will give it as a semi what like a what liquid form we are consuming into the diet. Okay, so that is the clear liquid plus dairy product and the pureed foods. Indications: it is a transition from clear liquid to regular diet. Even in after the surgery, before starting the normal diet, we, that means before starting the normal consumption of the rice, we are giving as a what semi that means the pureed diet can be recommending. That is to initiate the swallowing or the initiating the after checking the gag reflex. The client, even the client has the gag reflex, he can't swallow completely. Sometimes it takes some time. Okay, after the intubation or any of the surgery and all. So in such for the transition period, we can give recommending a clear liquid to the diet. And also if the client is having any GI disorders, and if the client is not able to tolerate any solid food, we can recommending a clear liquid diet. And here also high protein supplement is prescribed. Actually in hospital scenario, they have a special that liquid diet is there according to the condition. If the client is having any tube feed and all, we will, they have a special added some components, because it will mix with the sometimes low fat, like that all the things will be there, but they are coming as a special diet it will come. And third one is the mechanically altered diet. That is the consistency is modified in a pureed, mashed and a chopped way. Okay. Main indications like that I have said: dysphagia, dental problem. Even the client is not able to chew. If there is any dental problem, we will provide a pureed, mashed and a chopped. Like that means the consistency of the food is not a solid form. That means already it is making it soft, and we are providing. In case of dysphagia, dysphagia means difficulty in swallowing. Okay, dysphagia, this means difficulty, dysphagia means
Difficult.
difficulty in swallowing. And this one, dental problem, head and neck surgery, neurological impairment. Here also it will affect the chewing, swallowing and everything. So here also we are providing it the mechanically altered diet. And in soft diet, it is the easily digestible food, as well as it is having low fiber and the minimal seasoning diet. Here we are avoiding the raw vegetables, because the vegetables should cooked and make it in a soft way, then only we can provide. And the nuts and seeds and whole grains only we are recommending. It should be avoided in case of soft diet. Okay. And next one is fiber rich diet. Fiber based diet means there may be low fiber diet and high fiber diet. In which condition we are recommending low fiber diet? Actually I have said it.
Diarrhea.
Yeah, in diarrhea we are recommending low fiber diet, and in case of constipation we are recommending high fiber diet. Okay.
High
And
fiber
in what are the low fiber diet is recommended condition? Diarrhea, irritable bowel syndrome, gastroenteritis and partial bowel obstruction. In such cases we are recommending low fiber diet. So what is the main effect? It will reduces the bulking of the stool. Okay. And high fiber diet mainly indicating in case of constipation and to prevention of the diverticular diseases. Okay, in such cases we are recommending high fiber diet. That is to promote, that is to prevent the bulking of the stool. That means stool bulk can be good in increases. That means it will promote the peristalsis. It will soften the stool, and it can, the person can eliminate the or maintain the bowel elimination without any effort by loosening the stool. And here we need to, as a nursing consideration, we can gradually increases the fiber and adequate fluid intake, that is to prevent the constipation, bowel obstruction. When what happen in case of constipation, the stool can be accumulated, and it is, even if it is not eliminating through the defecation, what happened, it can accumulate it and it can become hardened stool. So later what happened, it can obstruct the bowel and the person cannot eliminate out the feces. It can lead to constipation, and constipation can further cause when the person strain for the bowel elimination, it can cause bleeding. That means the diverticular problem like fistula and hemorrhoid and such condition can cause in case of constipation. Okay, so to prevent that, we can recommending a high fiber diet as a management for the, even it can ask in the question as a management. For example, they will give some many question related to constipation and they will ask that what is the correct understanding of the client or the nurse's teaching statement they will give, and if it is included in that, it is the high fiber diet. Okay, for the, as a management of the constipation, that is the recommended diet for the low high fiber diet is the food of choice for the constipation. Okay, and the next one is high calorie high protein diet. Okay, usually it is used in case of burns, tuberculosis, even COPD. I have said cellular metabolism is higher in case of COPD, and to promote the wound healing, malnutrition management, we can HIV and AIDS. Here the client is not getting adequate nutrition, as well as this is the immunocompromised patients. Okay, as an additional supplement, we are recommending high calorie high protein diet. Example, peanut butter, wheat bread, rice, oatmeal, avocado, nuts, banana, whole milk, cheese, quinoa, whole wheat, pasta, dried fruits. So these are the high calorie and high protein diets which are recommending. Examples only. Okay, and physiological basics, proteins are mainly needed for our tissue repair, for our immune response. Okay, tissue repair, immune repair, and for the functioning of some enzymes and hormones, because all the functions, the enzymes as well as hormones are it need to be transported into our body. Okay, so the normal functioning, what is needed, protein is needed as its normal synthesis. Okay, so here when we consume high calorie high protein diet, we are getting adequate energy as well as we are getting adequate nutrient support for the tissue repair. For example, in case of burns, to promote the healing of the wound. Okay, and in case of COPD, the metabolism is higher, so to meet the tissue demand or the need of the energy demand of the tissue, we are supplementing additional caloric diet. Okay, and the next one is restricted diet. Restricted diet means we need to limiting the consumption of some of the diet. For example, in diabetes, in renal disease, we are limiting. I have already said. In celiac diseases, we are recommending the purine-free diet. In gout, we are avoiding the purine-rich diet is avoided in case of gout. Like that, some diet are restricted according to the condition of the patient. And the low fat diet is mainly recommending in case of GERD. GERD means gastroesophageal reflux disease. Obesity, we know that in obesity already there is high cholesterol deposition is there. If we are again consuming fat, it can increases the blood glucose level. So here we are limiting the fat intake. And also, if the client is not able to metabolize the fat, in case of fat malabsorption disorder, we are recommending low fat diet. And in case of steatoria, okay, steatoria also we are recommending a, because here also the fat is higher, so we are recommending the low fat diet, because the fat is eliminating through the fetus. That is the steatoria. Fat component is higher in the stool, that is steatoria. Here, what are the recommendations? We can avoid fried foods. That means fried food items contain the fat components. That means oily food, fried items, bakery items. Okay, these are grilled and baked food, and some meats are also, especially red meat and all, containing highest cholesterol levels. So we need to avoid it. Okay. And low protein diet is recommending in case of renal failure and the liver failure. Okay, because we know that in liver failure, what happened here, the ammonia in the liver cirrhosis or liver inflammation, the accumulation, that means the ammonia is not eliminating through the feces. Okay, what happened? It can lead to accumulation of the ammonia, and this ammonia can cause what hepatic encephalopathy. That means the ammonia can cause affect the neuronal tissue or brain tissue. It can lead to hepatic encephalopathy. So to reduce the ammonia production, we are recommending, because protein is the one source which are converting into ammonia. That means ammonia is produced from the protein. So in case of liver failure, we are recommending a low protein diet to reduce the production of the ammonia. As well as in case of renal failure, because the protein is converting into nitrogenous waste products. Okay, so but in case of renal failure, what happened, the blood is amount of blood which is filtered into the urine is limited because of the lower glomerular filtration rate. So what happens if the urine is not producing normally, this end product or the nitrogenous waste product is accumulated in the blood. It can lead to increased blood urea nitrogen, increased creatinine. Okay, that is to limit the nitrogenous waste production, we can limit the protein intake. Okay, these are the these are restricted, means we are limiting the intake. Okay, so here when the protein is restricted, there may be all the essential amino acids are we should consume a high biological value diet. That means this diet, because this protein is the one, the amino acid is metabolized into proteins. Okay, so here when we limiting the protein, it will affect the production of the amino acids also. Okay, that means high biological value diet is recommending in case of this low protein diet. That means if we are limiting the protein, we need to consume the energy with the consuming other products. Okay, and low sodium diet mainly causing hypertension. So we need to in case of heart failure, in case of fluid retention disorder, and in case of hypertension, we are recommending a low sodium diet. Okay, that means less than 2 gram per day is recommending. And here we need to monitor daily weight and assess for edema, because when there is accumulation of the fluid and sodium, retention of the fluid and sodium, it automatically can lead to edema and to weight gain. So the main conditions are, what are the conditions? Heart failure, it is very important. They can ask question from the heart failure. Okay, in heart failure we are restricting the fluid, and also we are limiting the sodium intake. And low potassium diet. Potassium, we know that the normal value is 3.5 to 5. Okay, 3.5 to 5 milli equivalent per deciliter. This is the normal potassium value. Okay, so when the potassium level is higher than 5, that condition is called hyperkalemia. Okay, if it is greater than 5, it is called hyperkalemia. And in case of renal failure also, urine production is low, so the potassium is not eliminating through the urine. In such cases, which can lead to hyperkalemia. That means the potassium is not eliminating through the urine because of the low production of the urine in case of renal failure. And in case of the Addison's disease, what happened? The adrenal gland is the one which produces the aldosterone hormone. Okay, adrenal gland produces which hormone? Aldosterone. Okay, aldosterone. And then aldosterone will act on the kidney. And it will reabsorb the sodium and potassium from the kidney tubule. It will reabsorb sodium and water. This is the functioning. But in case of Addison's disease, what happened? It will affect the production of the aldosterone. So the reabsorption of the sodium and the water from the kidney tubule is getting affected. That means here it can lead to this accumulation of the because here this sodium is not at all the produce sorry, not the reabsorption of the sodium and water is causing the aldosterone, but here also potassium is also not eliminating through the urine, because of the here water is reabsorbing, that means it will cause the what urine output is getting low. So when the urine output is getting low, what happened, because water is getting reabsorbed from the kidney tubule, so water is not eliminating as the urine, that means the potassium is not eliminating through the urine. In case of Addison's disease, it can cause hyperkalemia. So in such cases we are recommending a low potassium diet. Understood? In case of hyperkalemia, renal failure, you understood, no? In renal failure what happened, there is decreased the urine output, okay, decreased the urine output, so the potassium is not eliminating through the urine out. I know it is difficult, but urine output, so potassium is not eliminating through the urine. So it can lead to accumulation of the potassium, so hyperkalemia can be occur. So we are recommending the which diet, low protein diet is recommending. Okay, so hyperkalemia can lead to life threatening complication like arrhythmia, cardiac arrhythmia. Cardiac arrhythmia can lead to lethal effect or the life threatening effect, or can cause death of the client. Okay, and in hyperkalemia, how we can assess the in ECG, we can notice tall T wave. Yeah, tall T wave can be noticed in case of hyperkalemia. See, I am teaching about the nutrition, but how the nutrition is correlating with our disease condition. Now you got the clarity on that, how the nutrition is important for our diet. Likewise, if you are learning, it will be very easy for you. Okay, but otherwise nutrition is a boring topic. I am truly believing that. But if we are correlating with the disease conditions, we can, because they will not ask the questions directly from the as a nutritional part. They are asking the nutritional questions from the disease condition related only. So we should know what are the diets are contributing with the each disease conditions, and what are the deficiency, even if it is what is protein energy malnutrition, or what is even in marasmus what happened. These are the protein deficiency diseases. Okay, and in carbohydrate, what hypoglycemia, diabetes mellitus, hypoglycemia, that is mainly correlating with the carbohydrate. And in the fat, there is what hypertension and atherosclerosis, stroke. These are contributing with the what this the sodium, potassium. These are everything, not only carbohydrate, all the sources, that means carbohydrate, protein, fat, vitamins, minerals, and the water. Okay, and some vitamins means fat soluble as well as water soluble vitamins. All those are contributing our normal functioning of the body. Okay, if any excess intake or the deficient intake can lead to some of the disease conditions. Okay, and in cardiac diet, I have already said we need to restrict the sodium, we need to restrict the fat intake, or cholesterol diet can be limited. And here we can recommending high fiber diet. Why? Because this in the what sorry in case of cardiac diseases, it can lead to constipation. Okay, so if the client is training to eliminate the bowel, it can affect our heart function, or it can lead to, so that only those who are having chest pain, we are administering laxative, because to reduce the straining of the stool. If the client is putting extra effort for the bowel elimination, it can cause what, the worsening of the chest pain, or it can cause some sudden cardiac arrest. Okay, so here high fiber diet is recommending to prevent the constipation in case of cardiac diet. And also we are limiting the omega-3 fatty acids. Okay, so no, not limiting, we are including the omega-3 fatty acids, but the fatty diet, we are low saturated fat diet we are limiting. That means we are recommending a low saturated fat, and the omega-3 fatty acid is also essential for the cardiac function. So we are recommending high fiber diet is recommending, but we are limiting the sodium. And also in even in case of cardiac diseases, we are limiting the blood the glucose or the sugar items also, because the increased blood glucose can also contribute to the cardiac diseases. Okay, so we are limiting the blood glucose also. Okay, that means the main focus is to reduce the cardiovascular risk. What are the diet? It is very important. Low sodium, that means salt. Usually we are call it as a salt restricted diet. Low sodium means which one? Salt,
Yes.
yeah, restricted diet.
Per day.
Yeah, that means some bakery items. Okay, that salty and the dried items. Okay, those when we the dried fishes and all, we are adding some salt also. Okay, so in such cases we are what are the items which are containing extra salt, we should limit the diet. That is the salt restricted diet. Also we need to low saturated fat. That means this decrease the LDL. Because this LDL can contribute the cardiovascular disease. Okay, so we need to recommend a low saturated fat to decrease the low density lipoprotein. And also high fiber diet. Why we are recommending high fiber diet? To prevent the constipation. Okay, this is very important, so that only I am detailing. And to reduce, our primary goal is to reduce the cardiovascular disease. And for the renal diet, we are restricting protein. Okay, what are the things we are restricting? Protein, sodium, potassium, phosphorus, even, and the fluid we are limiting it. Okay, we know that in renal failure what happened, there is decreased urine output. Okay,
Yes.
yeah, decreased urine output. So what happened when there is a decreased urine output? Waste, nitrogenous waste is not eliminated through urine. So that means it can lead to accumulation of the nitrogenous waste. So we need to limit the production of the wastes. So as well as because there is sodium can be accumulated, because it can cause reabsorption of the sodium and water. Okay, so the urine is not, the amount of the urine is low, so that it can lead to retention of all these products, or there is potassium accumulation can lead to hyperkalemia, and sodium and fluid retention, it can lead to edema and hypertension. And also there is protein is that means accumulated in our body, and this fluid, the phosphorus is also not eliminated through the urine. Okay, that means it can lead to, when there is a renal failure, it can cause hypernatremia, hyperkalemia, hyperphosphatemia, edema. Okay, so and to reduce this conditions, we can limit the protein, sodium, potassium, phosphorus, and fluid. What are the indications? That is in case of acute kidney failure, chronic kidney disease, and even dialysis patients, we are limiting that. Next one, diabetic one. Yeah, diabetic, we are mainly focusing on the complex carbohydrate. Why? Because there carbohydrate can be two types, simple and I am giving the extra idea so that it will easy for you. Simple and complex. Actually, this simple carbohydrate, what happen? It will easily metabolize. Okay, easily metabolize and cause increase blood glucose. Understood? That means when we consume simple carbohydrate, it will undergo for metabolism easily, and it will rapidly increases the blood glucose level. But when we consume complex carbohydrate, no, it takes time to metabolize. So the increase of the blood, there may be increase of the blood glucose level, but there is a gradually only. Okay, gradually metabolism. So there is a sudden shoot up of the blood glucose level won't happen when we consume the complex carbohydrate. So for the diabetic line, we can recommend the carbohydrate, limit the carbohydrate. Mostly we are recommending a complex carbohydrate diet for a diabetic patient. Okay, understood what is the relation? That means when we consume, for example, if we consume excess rice, what happen, it can metabolize easily and rapidly the blood glucose can shoot up. Okay, but we consume the complex carbohydrate, the metabolism in a gradually, so that the gradual increase of the, that means our even our hormone can control it when we eat the food. No, when we eat the food, the hormone which is activated is the insulin. Insulin will activate and insulin will control the blood glucose level by decreasing the blood glucose level. When our body is starving, the glucagon is the activated one. So glucagon will increases the blood glucose. How? Because the glycogen which is stored from the liver is getting into converting into the glucose. Okay. So our dietary habit is mainly this, in the functioning of the insulin and the glucagon is mainly relating with the eating habits. That means when we when we in a fed state, or when we have the food, the insulin started to activate. And when we take any fasting, or when we our cells are starving, which one is activated? Glucagon. That means the alpha cells of the pancreas will produce the glucagon. So glucagon will get activated, it will increases the blood glucose level. Okay, so here in case of diabetic diet, we should focus on the complex carbohydrate, high fiber diet, lean protein, and control the carbohydrate intake. And also we can recommending to avoid the simple sugar and the refined food. Next one is a low purine diet. We know that the uric acid, okay, uric acid is the one which cause, which one increase the,
Uric acid.
yeah, increase the uric acid. That is the condition occur in case of gout. Okay, increase the uric acid. So we need to limit the purine diet. Okay, what are the purine diet? Like even veggies which will come, broccoli, zucchini, spinach, cauliflower, and fruits it will come blueberry, strawberry, apples, protein, egg, low fat dairy, yogurt, cottage cheese. Actually, the question mainly coming, they will ask about the cottage cheese. Cottage cheese is a what purine containing diet, it should avoid it. And the spinach is also we should avoid it. Broccoli also we should avoid it. And walnut, almond, avocado. Actually, all these are nutritious diet only, but it contain what? It can cause purine, or it can contribute to the increasing of the uric acid. So it should get limited. Okay. Then sardines, cottage cheese, yogurt, whole grains can be limited. Purines are metabolized into uric acid. It can cause accumulation of the uric acid, can cause what? The joint inflammation. Okay, that is the condition gout. So in case as a management of the gout, we need to limit the purine rich diet. That means the purine can metabolized into uric acid. Okay. The nutrient specific diet are the what? High potassium diet, which are mainly recommending for in case of just opposite, in case of hypokalemia or in case of diuretic therapy. Diuretic therapy, what happen? When we administer diuretics, what happen? It will promote the urine output. So the potassium can lose through the urine. For example, in case of which drug?
Lasix.
Yeah, Lasix. It can lead to what can happen? Hypokalemia.
Low.
Yeah, hypokalemia can happen. So here we need to supplement the potassium. That means the high potassium diet is recommending. Lasix or furosemide, in the question they won't ask about the Lasix, they will ask about furosemide. Okay. Hypokalemia can occur. But if it is a what potassium sparing diuretic, what happen? We need to limit the potassium. Spironolactone is a potassium sparing diuretic. Yeah. Here we need to restrict the potassium. Why? Because spironolactone will spare the potassium. It can lead to what? Can lead to? It can lead to hyperkalemia. Okay, that you don't confuse it. So we need to restrict the potassium. In case of loop diuretic, okay, or furosemide, it can cause the through the urine potassium is lost and it can lead to hypokalemia. Here we need to recommend the potassium rich diet. But in case of potassium sparing diuretic like spironolactone, it can cause what hyperkalemia. So here we need to restrict the potassium. Understood?
Yes.
And the yeah. Next, the high calcium diet, it's mainly increasing for the osteoporosis. We know that our bone health is, the calcium is needed for our, which one? Bone health. Calcium is needed for our bone health. So when there is a decreased calcium, what happen? It can lead to osteoporosis or thinning of the bone or brittle bone. It can easily cause fracture. So as to prevent the osteoporosis, we can recommend a high calcium diet. And in case of iron deficiency anemia, anemia means there is a deficiency of the iron. So in such cases, we need to recommend iron rich diet. Okay. Next one is enteral diet. Enteral means that feeding enteral. Okay, mainly nasogastric, nasojejunal, gastrostomy and jejunectomy. Nasogastric means we are inserting a tube into the nasal cavity and it's positioned into the stomach. So we can administer fluid through this nasogastric tube. In nasojejunal means through this naso tube, it is it is placed into the jejunum. Okay, that is the nasojejunal tube. See, in nasogastric tubes, we can see the marking of this tip.
Yeah.
See, in naso, I will select another one. Which color are you? Okay, this one. See, in nasogastric, the tube tip is placed into the stomach, but in nasogastric, see, the tip is positioned in the see, still here. Okay, this is the nasogastric and this is the nasoduodenal. Understood? Because here we if there is any stomach problem, if the stomach is not able to metabolize this nutrients, in such cases we need to feed, can administer directly into the jejunal or through the duodenum, so that the most of the nutrients are absorbed in the small intestine only. Okay, some the carbohydrate digestion or the carbohydrate absorption is started from the mouth and it's ending in the where in the stomach. Okay, that means the fat is not getting digesting into the stomach. It is starting but it is not finishing. All the entire nutrient absorption is ending or completing in the small intestine only. So till small intestine we can directly administer food into the small intestine. That is the jejunum or the duodenum through a tube. That is the jejunal or nasoduodenal. Okay, and then gastrostomy means what? Here we are creating an opening in the stomach and through the tube we are giving the feed. Jejunectomy means same like ostomy means opening. Okay, we are creating in an opening in an area of where jejunum and we are inserting a tube and we are giving feed through that tube. Okay, that is the jejunectomy tube. See, the TPN and PPN are also we are administering, that is through the central line only or peripherally inserted central line, PIC line. Okay, PIC line or through the central line we are administering the TPN or PPN. Okay. Main indications are when the GI tract has functional but the client is not able to swallow or the client is neurological disorder. In such cases the client won't get the swallowing or gag reflex. So we need to put tube feeding. And in case of tracheostomy also we need to put a NG tube or jejunectomy or gastrostomy tube because the client is not able to swallow. And in case of severe burns also we need to supplement extra nutrients. In such cases we need to give tube feeding. And the main management before the feeding, it's very important. We need to verify the tube placement. How we can verify the tube placement? By doing X-ray. X-ray is the confirmatory one. Okay, which one? X-ray. Through the X-ray we can verify the tube placement as well as by testing the stomach contents also. Okay, even if it is a nasogastric tube, by aspirating the stomach content we can test it using a litmus paper and we can confirm it whether the tube is in the stomach or not. Likewise we can assess the bowel sound also. Actually this in bowel sound, how we are instilling air into the stomach, at the same time we can auscultate the bowel sound. If it is in the stomach, we can correlate with whether the tube is placed in the stomach or not. And we can check the gastric residual volume. That means we can aspirate the stomach contents and we can check it using a litmus paper, and we can confirm it whether the tube is in the. So that means after the tube placement, before starting the tube, we need to make sure whether the tube is in the stomach or not. Okay. And also the main critical values, if the residual volume is greater than 100 ml, that means when we aspirate, even if we are initial to feeding, when we are starting, we will aspirate the stomach contents. We will check whether any residual volume is there or not. If the residual volume is greater than 100 ml, we need to hold the feeding. It is very important point. Why? Because that means there is some issue with the where the absorption of this feed, because there may the feed is not, the patient is not tolerating with the feed. That is the indicative sign of the increased residual volume. Even when we started the feed, before giving next feed, we will aspirate the stomach content, and if it is coming in extra, previous feed has not at all absorbed, and if it is coming as a residual volume, if it is exceeding greater than 100 ml, we should not administer the next feed. We should inform to the physician. We should hold the feed and we should inform to the physician. Okay. And also we can check the bowel sounds also. If the bowel sound is absent, or in case of paralytic ileus, okay, absent also, we should not administer feed. That means what happened? The feed is not getting absorbed and it is not converting it into the peristalsis is not happening there. So what happened? It will affect the bowel elimination pattern. So in case of paralytic ileus also, we need to hold the feed. That is the bowel sounds are absent. That is the paralytic ileus. Okay. And what is the positioning? Yeah, always when we give the feed, we can raise the head end to minimum. Semi-fowler's position can be given. Minimum at least 30 to 45 degree. We need to raise the head end. That is to prevent the aspiration. Okay. And also we can give the tube care also. What are the tube care we can give it? We can wash the tube after flush the tube with the water before and after the feeding. That means some otherwise what happens if we are not clearing out the feed through the tube. Okay, what happen? It can occlude the tube, and when we go for the next feed, the feed won't go into the stomach. It will obstruct the flow of the feed. So we need to, after giving the feed and before starting the feed, we need to flush with the water, and also we can check for what adequate look for any dehydration, as well as if there is any tube obstruction is there, we need to verify it. Okay, if there is any tube obstruction, we should not administer the feed. Okay, we need to change the tube if there is any obstruction. And monitoring of the intake and output, because if the patient is not tolerating the feed, and we can check the residual volume, and also even if you are administering the feed but the urine output is not adequate amount, that is also need to be reported. That means this metabolism is not making properly. So we can strictly monitor the intake and output chart. We can monitor the electrolyte, and as well as we can monitor the body weight also, because through these are the assessment tool. That means whether the client is getting adequate nutrients, adequate electrolytes, whether this client is tolerating the feed. Okay, like that we need to monitor when we start the feed. Our priority concern when we give administering feed, we can raise the head end. That is to prevent the aspiration. If we notice any symptoms of the aspiration, we need to, it is a critical complication, because it can cause aspiration pneumonia and can cause death, life-threatening complications. So while feeding the client, our priority concern is to prevent the aspiration. Okay. Next one, parenteral nutrition. Parenteral nutrition means simply, just I have shown in the picture, is this one. That means the TPN administration of the PPN administration. Okay. Total parental nutrition over the peripheral parental nutrition. Actually, peripheral parental nutrition we are administering usually through the PIC line. Yeah. Or through the peripheral line also we can administer which one? Through the, for example, replacement of any fluid. like RL, ringer lactate or sodium chloride, we can administer to the peripheral line. But if it is a TPN or any PPN, we can't administer to the peripheral. In such cases, either we can select this PIC line or can select the central line. Okay, central line means we are inserting the catheter directly into the SVC. Okay, so the means here the TPN or PPN directly can reach into the inferior vena cava or superior vena cava, so it can get metabolism. So but in case of main indications for this parenteral nutrition are the non-functional GI tract, severe malnutrition, and then cancer, burns, and post-major GI surgery. These are the main indications for the parenteral nutrition. And here in main composition are the glucose. This is very important. Glucose, amino acid, lipids, electrolytes, vitamins, and trace elements. These are the component of the parenteral nutrition. Okay. Main nursing intervention, we need to monitor the daily weight and the blood glucose level, electrolytes, because even the parenteral nutrition should contain all the elements like glucose, amino acids, lipids, electrolytes, vitamins. Sometimes when we start the total parenteral nutrition, it can rapidly raise the blood glucose level. That means it can cause what? The hypertension, hyperglycemia. So we need to monitor the blood glucose level when we start this monitor blood glucose level, because when we start this total parenteral nutrition, it can rapidly increases the blood glucose level. Okay, so we need to monitor it because it containing a largest primary energy source is the glucose. Largest amount of glucose is there, so we need to monitor the blood glucose level. And also other components, amino acid, lipids, electrolytes, we need to monitor it. Okay, whether the client is getting adequate nutrition or any excess for example, any electrolytes is means deficient or getting adequate intake or excess, like that we need to monitor. And also we can administer through the infusion pump. Okay, dedicated line. That means the important point is no medication is added in the TPN, total parenteral nutrition, through the TPN. When we administer any IV fluids, we will add some medications. Okay, but when we administer the parenteral nutrition or TPN, we should not add any medication in the TPN. Okay. And also discontinuation, it might be gradually. That means the volume which we are infusing, we can't stop it abruptly, because the volume can be reduced gradually. That is to prevent the hypoglycemia. That means through the TPN we are supplementing large amount of the glucose. That is for the energy source. But if you are suddenly stopping the administration of the TPN, what happen? It will stop the supply of the blood glucose, and it can cause rapid decrease in the blood glucose level, and it can cause hypoglycemia. Okay, so to prevent the hypoglycemia, we can discontinue in a gradual way, like tapering of the. Okay, that means sudden stoppage is not recommending, but gradual discontinuation is recommended. That is to prevent the hypoglycemia. And also after stopping the TPN, for example, if the client has developed any unusual complication or anything, we will stop the TPN. But immediately after discontinuing the TPN, we should start with the dextrose 10%. Why to start dextrose 10%? That to maintain the blood glucose level. Okay, that is to maintain the blood glucose level. Otherwise, it can cause what? It can cause hypoglycemia. Okay. And the main complications: air embolism, pneumothorax, hypervolemia, hyperglycemia. Air embolism means the client can develop sudden dyspnea, chest pain, and cyanosis. We know that these are the main symptoms of the pulmonary embolism. Okay, that means the air embolism can cause pulmonary embolism. So if we notice any sudden symptoms of this air embolism, we can provide the left lateral position or Trendelenburg position. That is to prevent the what travel of the air. Okay, that is we can make in the localist. We can provide the tenderline position or left lateral position. We can administer oxygen because it can cause what hypoxia. So it can administer oxygen and to notify the first we need to immediately we can provide the position, we can administer oxygen and notify the healthcare provider immediately. Actually, if it is coming as a scenario, okay, if it is coming as a scenario, if it is you can look, if any sudden onset of symptom has not occurred, our primary role is to what
Not
notify the
a healthy
healthcare provider immediately.
product.
That is complication we can't that is not in our hand, that is not, we can't manage it alone. So suddenly we need to notify the physician. Okay. And also pneumothorax, here the air is accumulating in the alveolar space. How we can notice pneumothorax? We can check for the breath sound. If it is diminished breath sound or absent breath sound, if the client is developing any respiratory distress, it is indicating of a pneumothorax. And in case of hypervolemia means what? Hypervolemia means there is
Uh, Decrease,
hyper,
yeah, increase volume.
increase the excess amount of the water, excess accumulation of the water. So what is the management? When the water is accumulated in our body, how we can notice it? Edema can be occur, jugular venous distension can be occur, weight gain can be occur. We know that the water and sodium is flows in the same direction. So when there is an edema, automatically there is hypernatremia also, hypertension can be also notices. Okay, so weight gain, sodium and potassium moves in the same direction. Okay, so that is you need to keep in your mind. Sodium and water, same direction. Okay. Okay, so we can lead to hypertension also. And in case of hyperglycemia, for example, if the client is getting total parenteral nutrition administration, we can monitor for the blood glucose level. That means the hyperglycemia can be occur. Actually, the two important point you have to keep in mind when the client is getting TPN. Okay, if that means the client is getting TPN or the TPN is on flow, you can watch for the high blood glucose level. Okay, if it is, if the sorry dear, TPN in a continuous or on flow, you can watch for the hyperglycemia. Okay, and if you have discontinued, what you have to monitor?
Hypo.
Yeah, you have to look for the hypoglycemia. Okay, that is the main difference we need to. That means when the client is getting TPN or PPN, parenteral nutrition, we need to monitor the blood glucose level to watch for hyperglycemia. But if we are discontinuing, after discontinuation of the TPN, what we need to focus? We need to monitor for the hypoglycemia symptom. Okay, and also how we can manage it by monitoring the blood glucose level every 4 to 6 hours, and we can even actually in the TPN we are administering insulin also. Okay, that means we can if the doctor has prescribed, we can administer insulin. Okay, and that means that is to maintain the blood glucose level. Otherwise what happen if there is a rapid increase of the blood glucose level can occur, so you can administer insulin as prescribed if the blood glucose level is high. Okay, and in case of infection, for example, if it is we are monitor for the infection when if it is a PICC line, or mainly in case of central line, we can monitor for the infection. So strict aseptic technique is used to care as a central line care, maintain a sterile technique, and also we can change the tubing every 24 hours. Okay, main priority principles of questions. ABC is the highest priority. Next, while giving feeding, we can look for the aspiration. That means we can raise the head and we can monitor for the aspiration. And those who are getting TPN therapy, we can monitor the blood glucose level. And if we are starting the feeding, if the residual volume is greater than 100 ml, we should not
Yeah.
administer the feed. And also even daily weight monitoring is the sensitive indicator of a nutrition status. That means if the client nutrition status is maintained adequately, there may be no weight loss or weight can be maintained in the normal. But if the ideal weight is not at all maintaining or that there is a weight loss is there, that means the client is not meeting the nutritional need. Okay, so we need additional supplementation. And also low albumin level or pre-albumin level indicate the malnutrition. Okay, albumin indicate the nutrition, and the blood glucose level we need to monitor as a TPN complication. Okay. See, and also we can analyze that means according to the condition we can correlate with what is the appropriate diet. Okay, and also we can monitor for the aspiration, and also if the residual volume is high, that is the question asking areas. Okay, residual volume is high, we should hold the feed. According to the disease we should plan the diet, that is the therapeutic diet. Okay, and how we can evaluate the outcome of the nutritional status? We can monitor the weight, we can monitor the lab values, okay, about the, and we can monitor the nitrogenous waste. For example, if there is any complication like blood urea nitrogen, creatinine, if it is increases, it notices that the client is having any renal disease. If the blood glucose level, that is indicating that any for the diabetes mellitus, like that. If the sodium is higher, that is an indicative sign of hypernatremia. It can be noticed in case of hypertension, like that. We should know in each condition what are the abnormal findings can be noticed. For example, if you notices potassium level greater than 5 or 5.5, you can look for the heart rate, or there can be, and you can look the ECG also. If there is high potassium level greater than 6 along with the ECG changes, that you need to manage immediately, otherwise it can cause dysrhythmia. Okay, immediately you should administer calcium gluconate, and next step is the in dextrose 5% you can add the insulin and can manage it. Okay, because insulin can also like managing the blood glucose, the insulin has a role to manage the potassium also. That means insulin plays a key role in maintaining the potassium. That means insulin has two role. That means insulin decrease, one thing is decreasing the blood glucose, and the other one decrease the potassium also, potassium in blood. Okay, that how means actually what is the function of this insulin means it will decreases, that means the glucose is transported into the cells, that means the cellular consumption of the glucose is carried or carried out by the insulin. Likewise, the excess potassium or the potassium which is present in our blood is transported from the blood to the tissue functioning. Okay, so that means the insulin has a key role in the maintenance of the blood glucose as well as maintenance of the potassium also. So as in case of hyperkalemia, we can first immediate management IV calcium gluconate. Second is the dextrose plus insulin, that is the secondary management. And third is the KX-lite solution. Okay, that is the order of the hyperkalemia. And here, and actually you can read this one also. I just elaborated with some examples. Otherwise, I have covered all the points. Okay, and for the easy memorization, I have created one table also. Same content only, that is with the examples. Okay, see. For example, see, this one is also very important. Vegetarian diet. Okay, vegetarian diet, there are mainly lacto-ovo vegetarian and vegan diet. Actually, lacto-ovo means here we can, the client can consume, lacto means milk. Okay, client is consuming egg and milk, cheese and dairy products, and egg is consuming, those who are lacto-ovo vegetarian. That means some persons are vegetarian, some are non-vegetarian, some are lacto-ovo vegetarian. Lacto means actually some are consume in vegetarian diet, they will consume only vegetables, no egg, only vegetable. Okay, because egg is coming under the animal product only. Okay, but in lacto-ovo vegetarian, they can consume the milk as well as the egg. Egg means ovo. Okay, lacto-ovo vegetarian means they can include the dairy products and the egg. Example, they can consume meat, fish. That means they won't consume the animal products like meat and fish, but they will consume the egg, that is the lacto-ovary. But in vegan diet, what happen, they will exclude all the animal products. That means they won't eat even egg also. They can include only fruit items or vegetable items, fruits, vegetables, legumes, and grains, pulses that can consume. Actually, here we can those who are vegan diet, we can there are some deficiency of this is very important vitamin B12, iron, and protein, because we are getting through this from the that is meat. Okay, this vitamin B12 we are mainly getting from the meat, fish. Iron is getting from the meat and fish, and even protein we are getting from the egg and all. Okay, so if the client is not consuming any egg, meat, fish, there may be deficiency of the vitamin B12, iron deficiency, and the protein malnutrition can be occur. Okay. Here also I have all the detailed low fat diet I have added with the example. You can go through that. And here this enteral nutrition, actually I simplified all the theory also. Okay, I have explained everything, and also I have created one table. This you need to what you can take a printout or anything, you can go through it, so that it would be very easy for you for your exam preparation. That means in on the previous day or the 2 days before, we won't read that whole PDF. At that time, if we have a table, we can easily have a look on that. Okay, for example, what clear liquid, full liquid, mechanical diet, soft diet, high fiber diet, okay, is avoided in case of diarrhea. And also high fiber diet is the treatment choice for the constipation. Okay, and also low fiber diet we are used in case of which one, diarrhea, irritable bowel syndrome, and it is avoided in constipation, like that. And what are the examples, these are very important one. You can go through that. And and also this low purine diet is very important. Okay, low purine mainly it causes gout, so we can avoid as an organ meat and all. Okay, like that we can look on that. Here see, in burns, high protein, high calorie. Kidney disease, low protein, low potassium. In hypertension, low sodium. Constipation, high fiber diet. Like that I have simplified, because nutrition is a sometimes it will we will get what topic it is, like that we will get. But I just simplified everything. You just go have a look and go through it if you have any doubt. And also see, in bowel is obstructive, that is what choose. That means if there is a diarrhea, we can choose the low fiber diet. And if it is a constipation, that means the bowel is slow or low bowel movement, we can choose the high fiber diet, that is to loosen the stool. And the kidney fails, what we can restrict the sodium and potassium. And there is a heart failure, we can restrict the sodium and fat. And if there is a wound healing is needed, in case of burns or in case of any injury wound, we can increase the protein. This protein is essential for the tissue repair. Okay, like that. And I have added question also. See, one question I can, time is already. A client with chronic kidney disease has elevated potassium and urea level. That means here the what is the condition? CKD. CKD, we know that the nitrogenous waste is not eliminating through the urine. So there is accumulation of the sodium and urine. So question is, which diet is most appropriate? Here the options are high protein, then high potassium diet, low protein, low potassium diet, high sodium diet, high calcium diet. Here already the potassium is elevated, that means the hyperkalemia is there. So we need to increase the potassium supplement or decrease the potassium intake. We need to increase it or limit it? Limit it. That means we need to limit the potassium diet, and also we need to limit the protein also, because protein contributing the nitrogenous waste products. So we need to limit the protein also. Understood? Because urea is the end product of the protein. So we need to limit the protein and we need to limit the potassium. It is a direct question. Okay. And one more question. A patient with severe burn, okay, admitted, which diet should prescribe? We know that in burns what happened, already there is tissue damage occur. So for the tissue repair, which diet we need to recommend? We need to recommending a high protein diet. In addition, there is metabolism is high in case of burn. So we need to recommend a high caloric diet also. So the correct answer is option B, Which one? High protein and high caloric diet. Okay. So here the BP, the client has a BP, how much? 160 by 100. That means the client is having hypertension. And which
Mm.
diet is appropriate? We know that in hypertension, which diet we are recommending? Dash diet.
That's
Which one? Yeah,
right.
dash diet.
Yes.
So in dash
Decrease
diet, what is
sodium,
the one? We are limiting the sodium. So what is the
sodium.
option? High sodium, low sodium, high fat, high protein. Which one? We need to
Low
choose
sodium.
the low sodium diet.
Low
Okay, that
sodium.
is the correct answer like that. Okay. And one more thing. In case of constipation, which one diet we need to
High,
focus? High fiber,
high,
low fiber, clear liquid, low protein. Which one?
high fiber.
Yeah, high fiber diet is we should. Actually, all these are because why we are promoting that it can promote the bulking of the stool and it can promote the peristalsis. That means the stool will get loosened. Okay, so that the client can uh, eliminate the stool without any effort. Here, in case of acute diarrhea, which diet is recommending? High fiber, low residue, high fat, high protein.
Diarrhea,
Mm.
low
Low residual diet.
sodium diet.
Yeah, high fiber. Actually, fiber and residue that is same thing only. Okay,
Yes.
high fiber is recommending in case of constipation, and
Constipation,
also low fiber or low residual diet is recommended in case of the diarrhea.
diarrhea,
Yeah. In gout, which is gout, there is increasing of the uric acid. So
uric acid.
what we need to restrict? We need to restrict the purine because purine contributing increasing of the uric acid. So we need to
Mm.
decrease the uric acid diet. That means to decrease the uric acid, we need to limit the purine intake. That means low purine diet is recommending in case of diet. Which is the correct answer? High purine, low purine, high
Low
which
purine.
yeah, low purine diet is good. In case of diabetes mellitus, and the client is having uncontrolled blood glucose level, which is the most appropriate one? High sugar, refined carbohydrate, high fiber, complex carbohydrate, high fat. Which one?
Uh, Refined carbo. No, high
High
fiber. Yeah.
Because in case of uncontrolled blood glucose level, what happened? We are recommending the complex carbohydrate only, not simple or refined. Okay, refined as simple carbohydrate only. The simple carbohydrate can rapidly increase the blood glucose level, so it is not recommending. High sugar diet also not recommending. High fat is also not recommending because this high fat diet automatically can increases the blood glucose level. So the correct answer is option C.
High fiber and
Yeah,
complex.
yeah. And in dysphagia, you'd see which one. The patient has a stroke and the dysphagia, difficulty in swallowing. Which
Liquid
diet is
diet,
the safest? What we need to smash the food, okay, or we need to make
or
into
liquid.
yeah, pureed diet is that is the mechanical soft diet is the correct answer. That is to prevent the aspiration. And in case of hyperkalemia, potassium rich diet, actually in the banana and potatoes containing the potassium, higher potassium level.
Okay.
Okay, so we need to which
Avoid
diets
that.
we need to avoid it? Option B. Which one?
Banana and potato.
Banana and the potatoes are the actually the condition of continuation of that which one? This second part of the theory, I have simplified the theory and added some examples also for the diet example. See, high potassium diet are banana, potato, spinach,
Potato.
orange, tomato, and the high calcium diet are milk, cheese, yogurt, broccoli, almond. High iron diet are the liver, red meat, yolk, spinach, dried foods. Okay, and also low purine diet are the low fat, egg, fruits, rice, peanut butter. Okay, like that I have added the examples also just to go through that. It will easy only. Okay, no. So, what do you feel, Ashwini, after the explanation of this nutrition? Is it tough or is it okay?
Okay, ma'am.
Okay, but you have to do questions. Then only we can, because each condition we need to correlate with. But okay, correlate and can just you have to think in case of hypertension, in case of celiac disease, in case of constipation, diarrhea, what are the dietary management we need to focus, what are the diet included, what are the diets we need to restrict like that, and what is TPN, and when we start the TPN, what are the important we need to monitor blood glucose level. When we discontinue the TPN, we can watch for the blood hypoglycemia, like that. You just reread this PDF, okay, and you will get thorough with it. No, actually it is a symbol only, but as it is nutrition, some some are becoming some what not a easy one, that all the diet and all we will get confused, but don't worry, I think the class help you to understand the nutrition in a easy way. Is it okay?
Yes, ma'am.
Okay, dear. If you have any doubt, you can ask. Okay, I think it was extended 2 hours today. Actually, my plan was to complete the nutrition. That's only okay, because is it boring nutrition?
No, 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 ma'am. Boring also I need to study only.
No, actually, it is not boring because you have to apply in your clinical settings. Because we all are
Yeah.
going for the taking care of the patient, live patient. If a patient has diabetes mellitus and the patient is asking to you, Ashwini, sister, what are the diet I need to avoid it that cause increased blood glucose level, and what are the thing we need to take care in case of diet? You have to knowledge enough to give an adequate information about the diet. Okay, so some person will ask if the client is having gout, they will see how I can manage the gout, how through the diet like that. You have to tell them you have to avoid the purine rich diet. Okay, that means the purine can increases the uric acid level. That means we should have the adequate knowledge so that we can impart the knowledge to the patient as a health education. Nutritional education is needed for the patient. That is not only in India or Europe, wherever we go, we need to give health education. So we should have adequate knowledge to give the education. Okay, so this is very beneficial one, not only for the exam, that is for your upcoming clinical area also. That is when we deal with the patient, we can if we have the knowledge, we can courageously give advices to the patient about the dietary management. For example, if you got a posting in the cardiology department, we know that the most of the diet are setting limiting in the cardiovascular, contributing to the cardiovascular diseases, so you can give health education. Okay, that means it is very important as well as it's beneficial, and it's if you are thinking with diet along with the disease condition, it would be easy for you to memorize. Okay, okay, dear, bye, 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 take care, thank
Okay.
you.
Thank
Okay,
you.
dear,
Bye.
thank you.